in the Middle East, a lot of women get maybe vaginal deliveries. So they come to our clinic, complain from white vagina and loss of sensation during sex. Actually, the complaint coming from the husband more than wife. So we will now talk about penoplasty. Penoplasty is a surgical procedure to replace the perineum, an external organ of the vagina. Here in this photo, we can see the difference before and after the surgery, difference between space between anus and vagina. Why do people get penoplasty? A lot of women complain from loose, bulging or gummy skin around their vagina, excess scar tissue after episiotomy or tearing during vaginal delivery, loss of sensation during sex, low self-esteem, vaginal irritation, discomfort, or pain. What's the causes of damage to the perineum? Vaginal deliveries, extreme weight loss or weight gain, trauma or injury, high-impact sports and exercise, other gynecological disease, genetic, and age. Does the penoplasty affect only the canal delivery? Canal, our intimate part? No, it doesn't affect. It only helps to tighten the opening to the vagina. Just the opening, not the whole canal. Like we see in this photo, before and after. What's the purpose of the penoplasty? It helps support reproductive organs and pelvic floor muscles, strengthens and tightens the perineum, neurovaginal opening, and repair loose, scar, damaged skin around the vagina. Restore function and comfort and improve the appearance of the perineum area. As we can see in this picture, the difference between before and after surgery. After the penoplasty, we can see increased length of the perineal body, convergence of the labia majora, and improved muscle tone along the labia majora. What does penoplasty help with? Improve sexual satisfaction, increase in self-esteem, returns the vagina to its preacher birth size, fixes scar or removes scar tissue. Studies proved that the sexual function was improved 6 months after the penoplasty. This procedure is ideal for patients without complaints of vaginal laxity. The width of the levator hiatus and the quality of the rectal muscles tone are assessed. A common practice is to measure the hiatus in the fingerprints with the muscles at rest and with muscles contract. If the levator muscles are either lax or widely separated, penoplasty will not be enough to satisfy the patient request for vaginal tightening. The thickness or diminution of the perineal body are noted. In this case, we have us 27 years old with no previous surgery request vaginal tightening for treatment of looser feeling during sex. And was balance zero. On examination, she had perineal laxity with intact neuromuscle reflex, no vaginal laxity, and thick levator muscles with extra. She got penoplasty, and after 3 months, she was very happy with the procedure. A penoplasty tightening some of the posterior vaginal muscles, aesthetic effect of penoplasty, and tighten all the outer skin underlying muscle of the perineum. We will not talk now about the technique in this procedure. Levator and muscle depletion. Maintaining the levator and suture no more than 1 cm of the middle edge. Prevent the creation of palpable suture ridge along the posterior vaginal wall. These are a source of discomfort during sex. And if more tension is desired, the second row of overlying suture can be placed as an imbrication layer to gain an additional 1 to 2 cm a position without creating suture ridge. Now we'll talk about suture material. Polybuckle knots or frame of monofilament suture must not be used because excellent choice to minimize the need for nodes location where they are at risk to fail. Now we'll talk about perineal closure. Why portions of the pelvic muscle should not be performed? Because they will place excess tension on the perineum. Next, transfer perineal muscle between the pelvic muscle and the anal sphincter are identified. They are approximate with 2 or 3 interrupted delayed suture. Moving to this picture, we can see the middle edge of the pelvic cavernosus and the perineal muscle are widely separated before the surgery. After the surgery, penoplasty causes them to converge centrally to the titan and interroutes and improve muscle tone beneath the labia majora. We will talk about crown stitch. It's an important stitch we can converge the pelvic cavernosus muscle in the right and the left. Okay, this is a video, I can't play it. Okay. Many women come to us after the two penoplasty, they feel pain during sex after 3 or 4 months after the surgery. So we must do evaluate every patient and we know what the causes of this pain. If the pain is from overaggressive levator application, we have two choices. We can inject the Botox directly into the levator muscle bilaterally at the site of application. The second option is a surgical release. It's performed through a transverse incision across the vaginal interroutes to enter the rectal vaginal space. If the pain from the overaggressive penoplasty managed, extend use of vaginal dilators or perineal release, making a vertical incision through the center of the penoplasty scar to release tension and suturing the left and right side of the incision independently. This can be done under local anesthesia. I developed a method similar to peduncle nerve block. Just by injection 2 centimeters lidocaine directly enters the muscles and under the skin. I do this after the surgery. It's reduces pain to minimum after the surgery and recovery done without pain. A lot of women say, oh, it's painful surgery. So I do it before or after the surgery. So it's no pain. It's amazing. The feedback was positive, no pain. After the surgery, I give some advice to ensure that the operation is successful. Weight reduction if overweight, reducing or avoiding smoke, Kegel exercise is important. Penoplasty procedure should not be deferred for patients who plan to have children through vaginal childbirth in the future. Now I will show some of my surgery. I do penoplasty with another procedure like labiaplasty, labia majora reduction. This before and after I do penoplasty with labiaplasty and labia majora reduction after 2 weeks. This patient I do penoplasty and fat grafting. Here I do penoplasty with labiaplasty and fat grafting. Thank you for